Every once in a while on this channel, we take a dive into Canadian left-wing YouTube, TikTok, or other content on other social media platforms. You know, you should hear out what the other side believes and see if they have any merit to their arguments. I'm going to say ahead of time, I don't think that we're going to find much merit here, but it's always good to see the sorts of things that these people say. And today we're going to be watching another video from our favorite internet super sleuth, Steve Boots, a man who truly believes that he is a voice of wisdom on the left. Without further ado, we have a video here where he's talking about conservatives are killing healthcare. And I'm just going to be using the 3-minute and 30-second version of the video that he posted to X here.
If recent years haven't made it completely clear, let me say it outright. Conservative provincial governments are trying to destroy healthcare. They are following a very predictable model, and they have been for a long time. They've been playing the same game for decades, and the results are clear.
I'm going to tell you right now, as we get into this video, he is going to contradict himself hard. He's telling us right now that the conservatives are destroying healthcare. We're using the same tactics we've been using for decades to undermine the system. Okay, Steve, explain to us what the system's currently looking like.
They have created crumbling healthcare systems where the public has been duped into blaming frontline workers instead of the actual people failing them. And every time things get worse, they come up with the same solutions. Adding administrative layers creates something they think is accountability, forcing frontline workers to just do more with less, just by micromanagement.
Sorry. Where were the unions protesting the bloat in administration? And sorry, conservatives were the ones expanding the administrative side of healthcare and then blaming frontline workers? If you've ever heard a conservative talk about healthcare before, they always say that the system is too top-heavy with administration and there's not enough assistance for the front lines. That's currently what is being discussed right now in BC. That's currently what's happening in Alberta, that the health minister, Adrian Lagrange, is using ways of breaking up the current bloated AHS system, turning it into a more regionalized system, and being able to slash a lot of top-level administrative jobs and moving that money towards the front lines. That's why wait times are currently going down quite quickly in Alberta. That's why wait times went down in Saskatchewan. And that's why wait times in provinces like British Columbia are going up, because the BC NDP has been favoring creating more management and efficiency monitoring positions. I don't even know what he's talking about. Name a politician in general who blames frontline workers. Nobody has ever actually done that. But in Steve Boots' world, where conservatives are evil and leftists are nice, well, obviously conservatives were blaming nurses and doctors, as if anyone has ever done that in their lives.
Or in many cases, they offload the services to the private sector. And this happens in all sorts of different ways. Some are on a smaller scale, like the private clinics that family doctors operate out of, which are quite common across Canada. Or this can happen on a larger scale, like in my home province of Saskatchewan, where private MRIs become common. And the reason why this happens is
Saskatchewan currently has the best wait times in Canada, so I don't know what point he's trying to make here. The systems that are most centralized in Canada are the worst quality in terms of their care.
It's twofold. Failing public health sector creates an opportunity for private investment in health in order to squeeze more and more money out of the public, but also
No, they do not. The private systems in these provinces, though, the way that they allow people to go use their public insurance at private clinics is basically one-to-one with the amount of money the public system gets. But there's more profitability for the private clinics, for private doctors, for general practitioners, because they are more efficient with their resources, because it's not the public system, and they are not going to have like a big board of supervisors, administrators, or HR reps when that's not necessary. So the difference is that people who are in charge of private delivery get effectively the same budget for doing the same amount of service, but they use their dollars in a more efficient way to see more patients and then be able to take home more money for themselves at the end of the day. Even right there, I'm not sure if you've noticed, he actually just admitted that the current public system is crumbling. Again, he has a conspiracy theory that it's been conservatives all along trying to undermine it. I don't know, like because there's some billionaire, Chip Wilson, is telling us to do it so that he can monopolize the system, or whatever billionaire boogeyman the left currently has. That's just wrong. The countries that have more choices, more supply of healthcare, tend to have cheaper and more efficient healthcare. We actually pay a lot in Canada for our public healthcare, because when you take the portion of your tax dollars that would be going towards healthcare in terms of its rate percentage of the budget, you're paying as a family of four, I believe it's like over $6,000, maybe even $7,000 as a middle class family through your taxes. It's a lot that you pay towards healthcare these days in its proportion of the budget. And your delivery absolutely sucks because there's no incentives to actually deliver healthcare efficiently. A healthcare system I really like is actually in the Caucasus, if you know the country of Georgia. Georgia technically has a fully private system, but it's still universal. What they do is that there are private hospitals and private insurance companies. But if you live below a certain rate of income, the government will give you a stipend that you can then go use at a private insurance company. And because there's so many private insurance companies, they will bend over backwards to give you as much service in for the amount of dollars that you have, even if it's just the bare minimum government amount. And so in Georgia, they have triple the number of doctors that we have in Canada. You can go see your general practitioner same day for about $25, or see any doctor, 25 Canadian dollars would be the equivalent. You get a knee replacement in that country, and because they're all private hospitals and they don't want to be sued, they're very careful at what they do. They're very high quality. It would only cost you about $300, and you could probably get the knee replaced within a week or a month, depending on how much consultation is required. Obviously, different people will need different considerations before they get a surgery like that. It's great there, and everyone pretty much has healthcare. Obviously, there's going to be a gap of people who are above the line of money that you get a stipend for, who then don't choose to get their own healthcare. But overall, it's a pretty good system. They do not have massive health problems, other than it's a former Soviet republic and everyone smokes. But you really can't help that. But I've rambled long enough. Let's get back to Steve Boots' conspiracy here.
Conservative governments don't view healthcare as a service. They don't view anything as a service. They view every public service as an expense line, as something to be cut, nothing more. You can tell
me which conservative government cut healthcare. Which one? They've never done it. Even Jason Kenney, when he technically cut AHS spending, he did it in the stupidest way possible. He wanted them to reduce their budget by 0.5%. And he was asking them to voluntarily cut wasteful administrative positions because Jason Kenney was silly, stupid, frankly. What happened was AHS just cut a bunch of nurses and frontline people to make Jason Kenney look bad and protect their own jobs. So that was an issue where Jason Kenney should have probably cut administration directly. But we're talking about a minuscule, tiny cut where he was probably intending that they cut not only positions that were not useful, were probably holding back the efficiency of the entire system. At some point, you actually get an administration so bloated, it's not just that the dollars aren't helping, they're actively hurting you because it's creating more hoops for people on the front lines to jump through in order to be able to deliver service.
Conservative politician again and again, the public healthcare is the most efficient way to spend our healthcare dollars, which is demonstrably true. The research
It's not. It's just absolutely not.
bears that out again and again, but they don't care. Even though it's...
This is coming from a man who's very likely never actually looked at the research. He has seen headlines from lefty organizations who say that, public healthcare is actually more efficient than private healthcare because maybe private healthcare was charging more for like an MRI to the public system than the public system does, leaving out the fact that the private system does not require as many dollars from the public for their administration because they're much more slender when it comes to their other spending. He's just wrong. Look at the Fraser Institute's efficiency reports from province to province. The more centralized systems in Canada have the longest wait times and the fewest amount of, the highest amount of patients per capita to each available general practitioner or family doctor. In BC right now, they're playing this kind of shell game where we have 85% of people in BC have a family doctor, which makes it one of the highest in Canada. But if you actually look at how many patients the average family doctor has in BC compared to Saskatchewan, it's monumentally high. And when you actually ask people, do you have easy access to your family doctor? The rates of people who say that they actually can see their family doctor quite quickly plunges down significantly.
As soon as you add a profit motive, somebody's going to be extracting that profit. They have an incentive to pull as much value as possible from the customer.
Does he believe that the public system does not have profit motives for individual administrators, for individuals who are providing services and providing overall support? This is the problem. Just because something is the public sector does not mean that it is operating in the public interest. Do you think executives in these public systems, like Dr. Verna Yu, who we actually at the National Telegraph back when we used to write more articles, we got her fired. She was making more than $700,000 a year in salary and benefits. And in the AHS in Alberta, I think the quote is that I've heard that there is like 350 plus people who work in management positions who don't actually manage anybody. Do you think they're not motivated to make money for not doing obviously useless work? The thing in the private sector is that somebody has to voluntarily give you dollars for service. You can't just force them to give you money without providing them actual value. In the public system, you can take people's tax dollars, work in some useless department of HR or administration or efficiency monitoring, and nobody can actually say boo to you because you got those dollars and they can't track them down and demand them back.
In this case, a person who's sick or in need of healthcare. Private healthcare is a very unique situation because the laws of supply and demand don't really apply here. You can't just demand less healthcare. You can't moderate your need. You can't just decide not to have cancer. Market principles don't work here. So when this gets turned over to the...
Well, that's the point of having in actual fully privatized systems, and I'm fine with having a mix of both, obviously, is that you have people who have insurance that they've been paying into for a while. Yes, you're always going to have the person who never had insurance or who was not looking after themselves. That happens all the time in the public system. People don't look after themselves because, it's free and I don't have to care that much. And then they bog down the system. The thing is that you need incentives for people to act better, whether that's paying for their own insurance. That's something like dental care in Canada. Most of the people who don't have dental care, it's not really because they can't afford it. It's because they didn't care about having dental care. And so by putting in universal dental care, you're going to bog down the system with people who really didn't pay money and who are not giving doctor or dentists payouts that are actually worthwhile for them to see them. So it's just going to make everyone with private dental plans go up.
Private market, as is the case in the United States, you wind up with massive overspending on things like insurance premiums and administrative costs, and the costs of things like deferred care or lack of access lead to way higher costs down the line because they're not investing in preventative care.
Do you know why also Americans pay a lot for their private insurance and medical care? It's because, America actually does a lot of just healthcare type work for people who fly in. So that also gets added to their GDP and then gets added to their GDP per capita on healthcare spending. The reason why private plans in the US can cost a lot is because it's not actually a private system. Medicare, Medicaid, because those systems do not pay out to doctors who are required to see a certain amount of Medicaid and Medicare patients, they then have to pass the cost onto those who are paying. So it turns into a system where someone who probably actually could have been able to afford their own insurance just sits on Medicaid or Medicare because they qualify based on their age, and somebody who actually struggles to pay for private Medicaid or private insurance is now burdened further by that person who's just choosing not to pay and using the easier, cheaper system.
All of this adds up to a public system that is set up to fail so the private system can swoop in and profit. And that's exactly what's happened in Saskatchewan. So Saskatchewan healthcare is collapsing across a number of fronts, and the Saskatchewan government's using that as an opportunity to turn things over to private healthcare.
And they've been doing a good job. Like, I don't even know what to say to this guy. It's like he just hates private healthcare. Really, that is what he hates. He doesn't like any private delivery not being done outside of a government that the government owns. Saskatchewan's been doing the best with one of the oldest populations on average in Canada. We should be, copying what Saskatchewan's doing, but because he's a leftist who lives in Saskatchewan, he now considers it like his job to just stump against stump against conservatives. And yeah, so now he doesn't like whatever the Saskatchewan government's doing because it's not fully leftist.
One example of this is the private MRIs that the Saskatchewan government introduced. They brought in private clinics where you could pay to skip the line. And that forces everybody into an impossible situation where you have to wait an extended period for a publicly funded MRI, or you can pay $1,000 for a private one.
Oh, wow. It's almost like, though, that took people out of the public lineup. Whereas if you're in places like BC, they actually have to tell you to go down to the US to go get an MRI because they have nothing available there. At least Saskatchewan actually has it in the same province, and it allows more people to get through the line. This is the thing. Leftists think that when we have a problem with too much demand for too little supply, we need to subsidize demand more. There's not enough, homes are expensive. People can't afford them. Just give those people money and they can afford them. That's not how that works. It doesn't actually work out in the long run. And you can't really do that with healthcare when more money doesn't get people more MRIs. But people like Steve Boots thinks that if we just add another $1 billion to the system, well, then somehow things are going to get better. While yes, you could potentially pay for more doctors to be doing more MRIs, the thing is that the systems that he supports never actually do that. They feed more money into the systems, increase administrative jobs, increase some frontline jobs, but because it's a public system, there's no requirement for them to actually be efficient because they're not running on any motive to be efficient. That's the thing with Saskatchewan. Once you introduce people who are able to deliver private MRIs, they're incentivized to do as many of them as possible. That's because that is their incentive from the government, that they only get paid when they're actually delivering this service.
Now, the Saskatchewan government sold this to the public on the claim that every time you paid for a private MRI, they would cover an MRI for the public system as well. But the actual effect of this has been a massive increase in wait times. The data is incredibly concerning. 90% of patients had their MRIs within 50 days in 2015. Today, that number's up to 82. We are paying...
Yeah, and that's just letting you know, that's still the best in Canada right now. During that entire period of time, wait times have gone up. Just look at the Fraser Institute, who's been tracking this since 1998. 1998, even though that was back when the economy was kind of starting to recover after we had that big debt crisis in the early 90s, wait times were 19 weeks for things. Or not even 19 weeks. I think it was 9 weeks, 7 weeks. This is very good for an average Canadian wait time. Now it's 28 weeks, 32 weeks on average. Saskatchewan still, for these more complex procedures, are still better than everywhere else. But he is going to use Saskatchewan as a specific example when he wants to get mad at the Saskatchewan government, but he'll never actually put it in the broader context of Canada, where there are more centralized systems that he, in theory, is in favor of, because they don't perform as well.
Out of pocket to wait nearly twice as long. Awesome. And I've had personal experience with this. My wife has MS, and when we were waiting for our initial diagnosis, we had to wait for months. And we were left in the position of deciding whether or not we were willing to lay down $1,000 in order to get our MRI right away, or get answers to those time-sensitive medical questions, or wait. Fortunately, the MRI came quickly enough that we don't have to make that difficult decision, but not everyone's so fortunate.
It's because Saskatchewan's actually doing a much better job than other places. I guarantee you, and that's bad. Of course, it's bad whenever you have to deal with something like MS in your life. But he should actually look at how the other systems perform. Saskatchewan is doing far better than the rest of them, and so all this seems just backhanded when he's going after conservatives because wait times have gotten bad in Saskatchewan over the past 8 or 9 years. But if you look at any other province, it's gotten far worse. And in the provinces where they're actually starting to use more private delivery and they're starting to decentralize the system, like Alberta, they're having wait times for surgeries go down significantly. I think that Adrienne Lagrange's track record in Alberta since she became the health minister after the last provincial election has been, I think, wait times for certain types of surgeries going down by an entire third. That's really good in just over a year of her being on the job. But whatever, because it's private, it's bad. And wow. And this almost like Steve's video could be advertising for private care. He is showing that the Saskatchewan government is providing more MRIs. Nobody else was providing, the state wasn't providing those MRIs, and the Saskatchewan government actually found a better way of doing it. And the thing is that you could say, well, the state could have done it. They could have just bought more MRI machines. Well, over the decades, it's never happened because the government doesn't directly manage the system. They should, in a certain sense. I think they should take out a lot of these executives who keep wasting money. Just look at the way that executives running things like the CBC waste money. That when the executives who are currently in charge, who are the experts that the left trusts, whenever they get a hold of the money, it never actually goes to increasing supply of care because their incentives are not to supply care because they get the money from the taxpayer, regardless if they supply the care or not. Anyways, that's it for me today, guys. I'm not sure if that makes you feel hopeful or not, because of healthcare in Saskatchewan's doing well, and we find out that the left is bad at arguing. But yeah, this is what a lot of kids will be watching Steve Boots' videos because he has a decent following on places like TikTok and YouTube. With content quality like this, I hope a lot of kids are starting to, find other sources of information. That should be it for me today, guys. If you want to donate to the Give, Send, Go, that's in the description below, as well as pinned at the top of the comments. It really helps me out if you do that. Let me know if there's any other TikTok videos from other creators you want me to respond to. I think stuff like this is decently fun and is a good frame for me to talk about issues like healthcare or other things that these people talk about in their videos. See you guys later.